All right.
Leave that in there, Matt.
All right. Let's get going. So today is the 19th. Is it the 19th? I think it is.
Yes.
Yeah, July 19th, Friday, July 19th. I actually just got back from the WellCare National Rollout in North Carolina. We were in I think it's the Blue Hills in Asheville.
Yeah.
So they hosted it at the Omni. Actually, it's the Grove Park Inn, and it was a really cool, historic, tons of history. Dan missed out. It was he was being a good father.
Priorities, man. Got to be a good dad.
Yep. So it was one of his son's birthdays, and so he opted not to go. He did offer his son to go out to an exciting insurance industry convention, but he passed.
No takers.
Yeah. no takers. So
they don't understand that insurance is cool until they're like in their 20s or 30s.
I will say, in hindsight, he made a good choice. Like he would not have. It was rainy and stuff, and he probably wouldn't have had as much fun. But it was a really, really cool event. We pulled up to this, the Grove Park Inn in just outside of Nashville.
Asheville.
Yeah, Asheville, North Carolina. Did I say Asheville?
You said Nashville.
Oh, I think I was just slurring my words. Asheville, North Carolina. It's kind of close to, at least it's close to Tennessee. It's close to the Knoxville side. But absolutely beautiful resort. We pulled up. They had old Model Ts rolling around, driving people up, and it just kind of felt like you stepped back in time a little bit to this old historical resort. Really cool. I know Dan would have really liked it. It was his jam for sure, so I felt a little...
It's on my list. That and the Greenbrier, I still want to go to.
Yeah, and the Biltmore. We didn't make it over to the old Biltmore, but it was really, really cool. Super beautiful. The resort was awesome, and the WellCare event team, shout out to those guys. They always do an amazing job from the coordination. We really appreciate their partnership. I think Dan and I have a lot of friendships with their team and their leadership, and they're second to none. Their leadership team is absolutely amazing. Just really enjoy spending time with those guys. Just like some of the other carriers so far, the national rollouts we've seen, Devoted has happened, Cigna, Aetna, and now WellCare, and United's going next week.
Yeah. So right now, I happen to know there's kind of a need-to-know basis only, like a meeting happening, today. And I know that their rollout is not a typical rollout next week. There's only a handful of people, like 10 or less probably, invited to that very closed meeting.
And we're not one of them.
Yeah, but I would also tell you that I think, like most carrier meetings, there's not going to be a lot of meat and potatoes to the meeting. I think it's going to be surface level, a lot of high level. I don't think there's going to be extreme levels of details coming out of that one either. I think people are hoping that there's a lot of information just because people have been waiting for United Healthcare in particular to kind of show their hand, and I just don't think that we're going to get a lot of information. I really think we're going to be like late August, early September before we're actually getting the full view and picture of what's going to happen this AEP.
Yeah. So what we want to kind of talk about and share today, a lot of this, we have to speak in generalities, right? Because this podcast is open to the public. We can't talk about anything that tips the hand to specific benefits or things that can't be released before CMS. So we'll speak in generalities.
Yeah, and for context of listeners, we have a broad audience now. We have a lot more subscribers. We have more listeners. Everything from brand new agents, people who aren't even in our industry. We found some consumers, listen just because of words like Medicare and X and Y and Z. So again, know that there is a lot of information that we have. And if you're one of our agent or agency partners, contact us. Absolutely. We can share strategy. We can give you specifics. We can really help you. But we can't just we have to be cautious about what we publicly disseminate out there, just for guidelines, compliance reasons. And so again, like Mike said, we're going to say what we think we can say,
Yeah. And so what when we talk today, we'll summarize the aggregate of what we're hearing from these rollouts that have happened before and what we're hearing from some of the carriers, and just kind of give you the most up-to-date, accurate information and our take onto what's going on and what we think is going to happen, because I think we've been pretty accurate on analyzing, where things are going and what's happening. And then you can kind of, read between the lines. But to be clear, things are still very ambiguous. And the phrase that we keep hearing from everybody is we just don't know yet. We still don't know. We think we're close to knowing. We think we're close to solidifying. Things are slowly starting to materialize and come into place.
Yep.
So, this also what happened yesterday was CMS officially.
Was it 2 days ago?
Yeah, yesterday or 2 days ago, CMS
Wednesday.
officially re-announced the FMV.
Remember, re-announced is your word. It's not an official word.
Well, they announced it before, and then they re-announced it. So they announced again.
I'm going to say they
reinstituted.
They walked it back. We'll say that. I'm going to say they walked it back.
Their version 2.0 or 3.0. Yeah, they did walk it back, right? As we've talked about.
And we're talking about Agent Commission, FMV. So many of you have already heard that obviously that was at a point of contention or a very sticking point because there's only so many dollars in the pie, so to speak, in the entire supply chain. And when they announced the extra $100 of FMV for brokers and the $50 renewal on the back end, it put carriers in a very hard spot financially. And, the thought was eliminating all those other forms of payment, right?
Correct.
And those other funds.
Yeah, so what we had hypothesized was going to happen happened, and because of the stay and the injunction that CMS put out, and then they had the summary judgment yesterday, which basically I think is what prompted this them to put out the official updated FMV, was they went and said, okay, well, the $100 that we'd built in for all these other services is now officially off the table for now.
Yep.
And so they've gone back to what I think the increase was 2.4%, very, very small, pathetic increase because, nothing's increased by only 2.4% over the past year, as we know. And so officially for new, it's 626, and renewal, our 313 is 313.
And that's the other states.
Correct. That's the other states still, California, PA, New Jersey, Connecticut, et cetera.
DC,
they all have higher FMV for some reason. Again, if anybody has a reason that makes sense out there that knows.
Yeah. I would love at some point for somebody to contact me and be like, hey, Dan, I heard your podcast about that question. Here's the specific reason why these states get more funding per sale in it than all the other states.
Yeah, just because I was annoyed by it, I recently, last week, had a report and read the cost of living in states as of 2024,
right? And
it does not even match up anywhere close
correct.
To what those higher compensation rates are.
Yep.
So just doesn't make any sense. But anyway, so what's happened, guys? They also redid the PDP commissions. It was having a significant increase in commissions, and a lot of agents were excited about it. But I think a lot because of what's happening in the industry.
Dun, dun, dun.
Yeah, I went through and I updated a graphic for CMS. I just said
while you're looking at that. So what Mike's referring to is initially, and we're talking about 60 days ago when they. 45, 60 days ago when they announced the first version of FMV, there were brokers who were really excited seeing a $200 commission, 200 and change for a PDP, going, oh man, I can sell MedSup and PDPs, and that's a monster commission. And here, the punchline is actually not that.
I updated it to this. I don't know if the camera can see it, but I crossed it out and wrote zero.
Your commission for most PDP plans is zero.
What we're hearing from a lot of these carriers, and at this time, subject to change because everybody kept putting an asterisk by this, it's looking like most PDPs across the country, including all the major ones from major carriers, are going to be non-commissionable.
Now, here's the bigger, the deeper gut punch is, at least right now with the asterisks and subject to change, is some of these carriers, and again, I don't want to dig into specific HICNs, PPPs, like those exact numbers, but generality, we've been hearing from carriers too that even renewals are going to be zero. So
correct.
That's like the big gut punch. If you've been an agent who has a significant book of business, you have a lot of MedSup and you have PDPs, I mean, those PDPs, they all add up. And when you have a couple hundred of them or 1,000 of them on the books, I mean, that's a lot of revenue that is in jeopardy right now.
Yeah. And so I've seen a couple agents that have kind of blamed these private equity groups in the lawsuit. And they were like, hey, we had a win here and you guys sued and got a stay against CMS and it kind of screwed us. And I'll just tell you this, it doesn't matter what happened with that one way or the other, because these plans were going to be going non-commissionable no matter what. And the fact that they increased the commission there just further solidified that, because there are so many other things that we've been talking about on the podcast over the past couple of months with the funding environment and this IRA, the Inflation Reduction Act, and how it's affecting the cost and the of PDPs, that there's just no money in the carriers have such a burden financially on the PDPs that they have to cut every which way possible, and commissions are one of it. One of our, I've heard that one of our carrier partners was spending $200 million
in commissions
commissions a year between new commissions on PDPs and renewals. And when they've been burdened with this Part D change with the IRA.
There's the smoothing process that is extremely, extremely expensive. And then we also found out that, of course, if a member doesn't pay the premium, then the plan can terminate them. But if the member doesn't pay their cost share, then they can't terminate them. And so with those rules and regulations in place, I mean, there's just so many other elements that have been added to trying to administer and run those PDPs that they just can't. You can't do the gymnastics enough to figure out a way to make any profitability.
Correct.
Do it.
So I do think, and we're very sympathetic to this because this affects our revenue as a company substantially. Obviously, we have a lot of booked PDP revenue, and if it goes down like we're looking, that's money out of our pocket as a business and revenue that we're going to be missing. And I know there are you agents out there who, especially a lot of you guys that have a lot of SUP business, that make a decent amount of your portion of commissions and revenue off of the PDP renewals. You're in a really tough position right now because the way it's shaping up right now, you're probably not going to get paid commissions on those going forward for this foreseeable future. Again, that could change by the time you hear this.
And then it also goes out there to, it's a conundrum too, because candidly, if the administration, the desire is to have trained, licensed, qualified, savvy professionals to help consumers to navigate their health care, when you're doing a needs analysis, there's so many people that spend more money and they have more complicated situations with their overall health with their drugs and their prescription medications than anything else. I mean, how often would you talk to somebody, they only go to the doctor once or twice a year, but they're taking 7 medications, and that's the bulk of their expenses. And for them, finding the right plan for them, that's where their significance is in savings, in authorizations, step therapy, all those other things. That's their pain point in healthcare, and having a professional navigate them through that and explain them. They're not going to have that now, because I know there's good brokers out there who are going to say, hey, these are my clients and I'm just going to help them anyway and do the right thing and find a plan and have them call 1-800-Medicare or whatever else. But it's not going to make any sense for an FMO to be paying money to transmit it through an e-enrollment tool when there's no commission. I mean, there's just no economics. How can an FMO pay an enrollment tool, whether it be DRX, Connecture, Sunfire, any platform like that, and say, yeah, agents, go ahead and transmit all this volume of business. We're going to pay for all that and incur the cost, when there's absolutely no commission there. And so that's another big conundrum that as a result of this, I'm saying, like, well, what is the intention? I mean, what is the intended or unintended consequence here? Because now you have all these professionals who, this is important, and they're not going to be compensated to guide consumers through their process. And I think 90% of brokers are going to go, I don't get paid for this, so here's your Medicare supplement, call this number and figure it out.
Correct.
There's going to be the small percentage that are like, hey, I'm just going to step up and do the right thing anyway.
Yeah, and it is going to be increasingly difficult. And so we'll spend some time talking about what you should do as a good agent and how you can use that to your benefit on that. But one of the things that I think we're going to do another podcast on the Inflation Reduction Act and Part D, as we're seeing a lot more of these things clarify, because we could do a whole episode on it right now. There's a lot of other things in there that they've come out with this Part 2 to it and all these things that we're really seeing how it's going to affect the industry. And it's honestly a massive reshaping of it.
I'm waiting for we had the Empire Strikes Back, and now we're waiting for the Return of the Jedi version to come out before AEP, right?
We're going to have the Return of the Jedi, and then we're going to have the whole other trilogy too before the end of the year. So we'll get into that as well.
Are you impressed that I remembered the sequence of the sagas?
Yeah, because that's when Star Wars was good before it got destroyed. Anyway, so now we've got Star Wars references on the insurance podcast, but
that's an opportunity, Matt.
Yes. So there's a lot going on with the PDPs, guys, and I think that it's going to place agents in a position, like Dan said, where they need to figure out a way to help their clients, but there's a lot of disruption coming there. And so I think if you're an agent and you've been one of these supplement sellers, now might be the time of year where you may be forced into maybe selling some people on Advantage plans, or looking at that, or reevaluating that, because the most likely scenario is prices are going to jump up quite a bit on supplements, and the PDPs, the premiums, are all going to go up substantially. I can tell you this.
I can tell you.
Go talk about the premiums for a second.
We're not going to have 50-cent plans, as many people have said. I think you're going to be, and this is a very unofficial, this is Dan's guess.
Ballpark.
You're going to see PDP plans in the $25 to $150 a month range.
Correct.
I mean, I know that's a really good job, Dan. That's really accurate. But I really do think that's going to be the swing. And usually in years past, you had, like, let's say the Humana Walmart PDP plan that was like the cheapest or lowest plan, or, the WellCare, 50-cent plan that they have currently, or, and you go through, there was always some carrier that had like the lowest, cheapest plan that, and they had all these benchmark plans that were out there too. And always there was those people who were like, I don't take meds. Okay, let me just buy a PDP so I don't get the penalty. Mm-hmm. I don't see those plans being around at that cheap mark. You're going to be seeing again, $25 to $150.
Correct. The other thing that you're going to see is you're going to see carriers coming out with much less diversity of plans. They're going to be anywhere from 1 to 3 plans per carrier. You're not going to see like these days where they had 5 different iterations of PDP plans. You're going to see, hey, you want a PDP plan? It's this one. We got this one, or we got one of these 3, depending on some of your cost sharing. Again, I don't want to talk too much about PDPs and this Inflation Reduction Act, but before we move on, one thing that I want to clarify that's a little bit different about this massive change to our industry is this is from the Inflation Reduction Act. I'm still trying to wrap my head around how this actually is better for the average consumer. It's going to, my read on it is it's going to increase costs for about 90% of Medicare beneficiaries, right, and then help maybe 10% of beneficiaries that have expensive drugs on their costs overall. Correct. So I again go, where's the big win on this? And the other clarifying piece too is this was an actual piece of legislation that was passed by the government, and it is not just clarification and updates and mandates from CMS. Yep. So as we've been talking about, overreach and regulatory authority from CMS,
it was an actual bill.
This was an actual bill. So these things are not equal, and the Chevron doctrine repealing is not going to necessarily have any bearing or applying on this, and you're not going to see the type of challenges. This was actual legislation passed. So this is pretty much here to stay, and a big bomb.
Unless there's industry. A repeal, or unless they, introduce new legislation. So that is one thing that's, and again, going back to, you said, we like to be fair and try to give a pretty balanced approach to everything. You kind of mentioned it. We think that this is actually going to harm 90% of consumers out there, that smaller fraction, 10, 15%, who have really high expensive drug costs are going to win from this. But more people are going to lose, obviously. And then also a byproduct of this has just been so many plan options being reduced. And so people are going to ultimately end up with far fewer choices as far as plans available, what the formularies look like, what those benefit packages look like. And so I wouldn't be shocked if more than 50 to 60% of your PDP options are eliminated this coming year.
Yeah, and so if you're an agent out there, specifically an agent that has a big book of PDP business, you write a lot of supplements, I would honestly encourage you to take a look at what's going to be best for your clients, and that may be more Medicare Advantage this year than it's ever been before, because yes, there's going to be a lot of disruption in the MA space, but when you look at it, and once you start calculating what these increased costs are going to be for the supplement premiums every month, the new expensive premiums on the Part D, and then the fact that there's going to be increased deductibles and cost sharing on those PDPs, and you do that total analysis, I'm going to guess that even more people than normal are going to come out financially advantageous on Advantage plans. Yep. And so I'd really encourage you to take a look at that.
Now, two things. Now, I know I'm going to have the trolls coming out of the woodworks, and we're just talking about the cost perspective. We're not talking about access to care and fee-for-service and everything else with Medicare supplements. Yes, we are very educated on that. Absolutely. We can talk about MIPA and MACRA and every freaking thing. And I was around when we were selling, J plans even. So I very much understand supplements. But do we want to segue into SARS? Were you going to talk about that? So it's a good moment for me to also start talking about the counter to that is, well, Mike, you're saying, you're going to be selling more Advantage if you're a supplement and PDP seller. But what about all those areas where there's not a Medicare Advantage plan? Because there's going to be more of them this coming year. Again, like we're talking about, I've even had a little bit of a gut punch in the last, I would say, 2 weeks. Because we've been talking on the podcast from, January. For 7 months now, we've been talking about the impact of this call letter and what's going to be happening. And we've been seeing what the impacts would be and forecasting it. But when I'm actually getting the information about how bad the SARs are,
so just to clarify, a SAR is a service area reduction.
Yeah, areas in which carriers are removing their plans and not offering it. And so again, when you start looking at insurance plans and then building product, there's counties that are more profitable, especially metro areas. They can establish better networks. There's more hospital facilities. There's more providers. They can meet network adequacy. They can have more of a negotiation where they can go into a metro market, establish these networks, meet the adequacy, be very profitable, double star bonus counties. When you start looking at the rural areas, the underserved, the low income areas, some of those areas don't have as many choices as the metro areas. There's more risk, smaller numbers when you're looking at law of large numbers. There's a lot of factors that go into those rural areas not being as attractive as some of the major metro areas. And so I think you're going to be seeing whole states, and I think you're going to be seeing counties, and more particularly rural counties and areas where carriers are pulling their products. So we're talking about saying, hey, you're going to be selling more Medicare Advantage. There's going to be more areas of the country this year where there's not even Medicare Advantage. And we're going back to those days in some areas. And we're going to be saying, oh yeah, your choice is original Medicare with this not very good looking or attractive PDP, and a supplement if you can afford it in some areas.
Correct. And just to clarify, we're not talking hypotheticals. We just can't talk exacts or specifics because of, CMS regulations and things.
Yeah, we can't really talk about specific stuff until after October 1st.
All of these carriers are going to have SARs, all of the carriers, service area reductions. And just to clarify, like Dan said, the funding environment, they're not profitable in those counties. So they're stuck with getting forced to lose money, which businesses don't want to do, or they're not profitable. They can't do a good job there, or they have to completely pull out. So that's what a service area is they're eliminating their plan there. And so what's going to happen is we know of many states already, a list of the carriers where the carriers are leaving entire states at a time. And so I'm just in my experience in the industry over the past 15, 16 years, your experience, even longer, I'm guessing we're going to see 10 times the amount of SARs that we've ever seen before, the amount of service areas. Do you think that's about accurate? Maybe more.
I don't know about 10, but it's going to be more impactful than we've ever
It's going
seen.
to be millions. Millions of people are going to have their plan SAR'd, okay?
Yeah, and things are being, I even saw a political ad already, and it's, of course, taken out of context, but, there are going to be significant people who don't have their plan. Now, it's being kind of spun that they're not going to have any health care, but there are going to be millions of people who, I have been even online on LinkedIn and hypothesizing and talking to people who are, in my opinion, industry leaders about it. And we were talking about how bad is the shopping environment going to be this year. I've even been saying, well, hopefully, it's because of I'm not going to say the word, the E word that happens in fall and November. But because of that cycle, I was thinking maybe there would be a distraction and people wouldn't be as focused. But knowing that millions of
distractions.
people are going to, be getting those SAR letters, I mean, they're going to be forced to shop.
Yeah, and so what's going to happen, guys, on the other side, everyone's going to start off in the hole a little bit. Because like us, we have what we're doing is we're analyzing our book of business where we have plans and we're already analyzing where we're going to lose business. So we're going to start off in the hole. Well,
because like everything, right, we're looking at how much we have and in theory, how much of that business are we going to be able to contact that beneficiary, place them on a plan, do that. Like that all very much depends. Is it 50%, 60%, 70% of that business? What is the threshold of those people we can actually reach?
Yeah, and conversely, though, there's going to be massive opportunity. And my read on the situation is pretty much from the start of October 1st when we can start. I think we'll probably know what these plans look like maybe a couple weeks to 30 days before.
Think almost like window shopping, like ACA, where you find out what plans look like 3 days before, and it's like, SMF, here you go.
Yeah, we're gonna find out when the beneficiaries do with their ANOCs. That's how we're gonna find out this year, basically.
Almost, yeah.
And so basically, what you need to do is play your defense, handle those people from that October 1st to October 15th time where you can queue them up. Again, we can't take applications, but do your service work, get a game plan for those clients that you're going to need to save and change.
Build their Sunfire profiles, get them all ready.
Get them all ready on the 15th. You're knocking out all your saves and then go into full offensive mode and find these areas where there are SARs, that you need to help other people, because there's going to be more people than ever that need help this annual enrollment. And we're going to see people, and my read on it, especially with a SAR, a service area reduction, they also get an extra 60 days, 60 or 63 days, in
January and February, even after
annual enrollment ends. So what we're going to see is almost like a super annual enrollment this year, and then it's going to parlay into open enrollment. So you're going to have this really chaotic, long grind of a sales cycle. And then, like Dan had said, because of that major event that's going to happen this fall that starts with an E, people are not going to be paying attention, and then they're going to go to start using and utilizing benefits January 1st or in January, and they're going to go, oh my heck, my benefits changed, my co-payments went up, my drug costs increased, and they're going to be reaching out and they're going to be interested. And so open enrollment and the SAR times of January and February are going to be massive too. So we're going to have a long selling session.
We still have the coordination of care alignment happening in California that's still kind of dragging on as well. And, more of that to come. And so I think those are all elements that are going to keep people very, very, very busy. Yeah,
and so it's going to be, again, for those agents who are paying attention and you're out there going, oh, crap, this seems like a lot of negative. There's going to be a lot of opportunity for the agents that hustle. So you can use this to grow, to have a...
I'm going to add two things to that, too, before I forget. First is we were talking about that. Ultimately, our perspective from me, owner at Agent Boost Marketing, I'm sitting here thinking we're going to win from this. Like, yes, we're starting with, a little bit of a shit sandwich at the beginning of AEP with, all these impacted SARs and our membership and our vested block of business that we're going to have to move, find a home, service those members, and get them onto a new plan. Yes. But with all the chaos and disruption, we're going to come out with a net win from all this. We're going to have net growth. It'll be good for us. But the one thing that I did say, who's going to lose? So there's organizations that are going to win, and I hate for everybody to keep hearing this, but the large organizations that have scale, that have processes, that have everything, systems in place, the big call centers, people like that, they're going to win because they have the capacity and the bandwidth to do massive numbers of enrollments in short periods of time. The people who I think are going to lose are sadly, the field agent who has a certain pace or bandwidth and can only do, let's say, 100 or 200 or 300 enrollments per season because that's like their pace and that's the most they can do. And when they've accumulated a book of business in a local marketplace in some of these geographical impacted areas, and they've got a book of business of 1,500 or 2,000 clients or something like that, they're just not going to have the bandwidth to get to all of their members, and I see their books of business getting absolutely pillaged this AEP. That's just my 2 cents that I've been having conversations behind closed doors. I know you don't like to hear that, everybody out there, but that's the reality.
Yeah, so I think that's going to be difficult. Like if you're not diversified, right? If let's say you were a top agent in one specific state with one of these plans that's going to be SARD, and now all you have to do is you just basically have to save as many people off the sinking Titanic as possible, and you just have to know that you're not going to be able to service all those people. So
your block of business might go from 800 to 300.
So, but again, you're going to have some extended time on the back end, which kind of leads me to the next critical threat or I don't want to call it a critical threat because, again, there will be opportunity too.
Don't be a fearmonger, Mike.
Yeah. The other challenge, the other opportunity for agents to overcome, the other obstacle to overcome is going to be the elimination of LIS and DSNP quarterly SEPs for next year. Okay. And some of my agents have hit me up pretty hard on this, and they're like, "Oh, Mike, that's the end of the train, the end of the tracks for us because we do a lot of that. How am I going to get over it?" And there is some difficulty there. And so CMS has come out in the call letter and said that unless you have a fully aligned, an aligned plan, or a HIDE, a highly integrated dual, or a FIDE, a fully integrated dual plan, that you are not going to be able to utilize the quarterly SEP is going away, and only those plans that have that are going to be able to pull people into their plan on a monthly basis.
And I keep saying, how is that going to be enforced?
Well, the SEP won't be open. Is that what you mean?
Well, meaning like if an agent writes a dual that's not a FIDE or a HIDE, it's up to that carrier and their enrollment department to accept the enrollment or not.
Well, what I had asked some of our carrier partners was, I said, just so you guys know, I think there's only 13 states in the country out of 50 that have some sort of HIDE, FIDE, or fully aligned dual plan. So, and it's less than 17% of the Medicare dual population has access to it this time or covered by one of those plans.
Yeah, and so what Mike's alluding to is even if you are in one of those states and you're selling in one of those 13, that one particular plan that is a HIDE or a FIDE may not always necessarily be the best or the one that is the sexiest with the best benefits and has most of the enrollments. It might be a smaller plan that has 5% of the market share.
Correct. So again, I go, where the hell is the wisdom in this? Because now you're going to, I really don't think CMS even understands how the marketplace works and how their own products that they're regulating actually operate. Because what you're going to have then is they want fairsies and samesies and equality all across the board on everything, all this regulation. But by doing this, they're going to say, well, if you randomly happen to live in one of these states, if you're a dual that needs help, then you can enroll all year long into one of these plans. But if you're not, then too bad, so sad. You don't have access to make a plan change. You have to do it during annual enrollment.
Well, and that might be the prod that they're saying, well, then carriers, you should make your plans be HIDEs and FIDEs then, and that's where we're wanting things to go, and to have HIDEs and FIDEs. So get there.
Yeah, well, that's obvious, but what's going to happen then at this current time, I keep thinking things will change. I keep thinking they'll come back from that ledge. They'll realize the error of their ways, and that will not happen.
Now I also will add that, again, the way that the call letter was written, there have been lawsuits and they challenge certain points of the call letter. And there have been those injunctions, and we've been talking about it. And of course, severability is what they wrote into. So meaning that, hey, if one part of this call letter is deemed, illegal or not legal and it can't stand, then everything else survives, right? Well, and so are we just going to keep waiting? And could a carrier or could an entity have another lawsuit and challenge that and get an award and a stay? Probably, but again, I'm not an attorney. I'm just
It
hypothesizing.
Seems arbitrary and capricious to me.
So what I'm saying is maybe that gets challenged. Well, then maybe another part of the call letter gets challenged. Maybe there's another lawsuit. I mean, we may not be even towards the end of the lawsuits challenging different components of the call letter is all that I'm saying.
Yeah, and so as it is right now, I think a lot of agents are what we're hearing clarification on is even if somebody is newly appointed status as a dual, they get Medicaid for the first time, right, or they get LIS or a change in LIS status,
yep,
that even that is not generating an SEP for them, and people will be essentially unable to access or enroll in one of these plans until annual enrollment.
Which to me, that's a killer because, I mean, for anybody who's been in the business for a long time and you understand it, when somebody gets that LIS eligibility, boy, your options really change, yep, or you lose your status. I mean, the type of plan options available to you when you're either gaining status or losing status is significantly different. And it really should have an SEP there for them to align and get a plan that's appropriate based on their current status.
Yeah, and so for you agents, we have, and if you're one of our agents, because I actually even just got cornered in the hallway by an agent last week, and I was like, don't worry about it, man. Like we'll have a solution and a direction. We do have a really good solution to help you be able to do business year round as of next year. I think it's going to be, the sky's the limit on how much you can write an opportunity until the end of open enrollment. And then we're going to have a strategic shift.
We're probably not going to share a lot on this public episode on that, but
we have a strategy, so don't worry. And if you want to know we're
zero worried about being able to write plans and have a strategy year round.
Correct, because we're just going to change our game plan a little bit, is what Dan's alluding to. And so if you're interested in what we're talking about, we don't want to share our hand too much publicly. We give out a lot of good, I think is good, free information, but we've got a strategy for you agents.
Yeah, the lurkers can only get so much info from us.
Yeah. So a couple other things that I want to just get out there before we wrap this episode is one more thing that we're learning is you're going to have to learn some more acronyms, guys. There's going to be a change to some of the SSBCIs as we knew the.
Those are always crappy. I mean,
the supplementary Social Security benefits, and now as we know, as part of that call letter, they changed the way that these carriers were able to build in and layer in these benefits into these plans based on that language of being able to qualify for these extra benefits and dollars based on that. And there's a new thing that you're going to need to get familiar with called VBID, which is value-based insurance design, okay? Right. And so the VBID, you're going to see some of these plans for 2025 have some of these ancillary supplementary benefits.
So to clarify, VBID is the new SSBCI.
It's going to be, where one window closes, a door opens, whatever that saying is. And that's what the carriers are like, oh, well, this isn't a SSBCI benefit.
This is a VBID.
This is a VBID under VBID design, right? So you're going, and they will clarify how those benefits are going to be built into these plans. And you're going to have to check the evidence of coverage in there because...
So there's a whole suite of extra benefits that your client could qualify for under VBID. And there's some states where you actually still have SSBCI and VBID.
Correct. And there's been more of the need to know portion of this coaching point is the SSBCIs, they're going to be more selectively available because you're going to have to qualify for them more stringently, and there's going to be more oversight and regulation, not just like, these are SSBCIs, wink, wink.
The hard thing I hate about that, and just being candid in practicality, and just like when the rubber hits the road and I'm an agent and I'm like, hey, here's this plan, and you could qualify for these benefits, but I mean, honestly, I don't know if you qualify. So I can submit your application, but look, no guarantees, no promise. I don't know if you're going to get these benefits. Well, so then of course what happens? If they get those benefits, they're actually pumped with the agent. Absolutely, I'm stoked. If they don't get the benefits, what is the beneficiary doing? They're making a complaint. They're saying like, I signed up for this plan under false premise. I thought I was going to be able to qualify for these benefits. The agent lied to me, that SOB. I'm filing a CTM. And, so it adds another layer of complexity in the sales process that I don't like putting that burden on the broker, candidly.
Yeah. So that's, learn that word, VBID, value-based insurance design. That's going to be, equivalent to the new versions of a lot of the SSBCIs going forward. And then the other thing that I want to put out there for a lot of you, as we start seeing final, what the summary of benefits is going to look like, what we're hypothesizing is we're going to see more plans that are going to have a premium this year, and they're going to be a smaller premium due to what's called NABA, N-A-B-A, the national average bid amount, right? And so we could do a whole podcast on that and on what NABA is, but what happens is when the carriers filed these plans, and CMS, like everybody submits their plans, and then CMS goes, well, let's take the national average bid amount, and then here's where you're an outlier one way or the other.
You're either above it or below it.
Yeah, you're either above or below that, and then you get either a rebate or you get like you have to
have a premium.
A premium that you have to put into that. And so what we're hearing is that some of these carriers, we're going to probably see small premiums on plans that would have otherwise been a $0 premium.
Well, because they don't know when they're filing, they don't know what that average is, and so they're guessing, and CMS doesn't tell them. And so again, when you're filing your plans, this year it was much more complex than in years past. And so they're basically the carriers who are missing the mark on certain plans, to Mike's point, you're going to see a plan that's like, oh, the consumer gets $4 back on their Social Security, $4 buyback. You're going to have someone that's like, oh, this plan is a $3 premium.
And it's going to be a really annoying complexity if it goes that way. And just so you guys know, in years past, usually these carriers, the difference is like $1 or $2. Like they're off by $1 or $2. And this year, a lot of the carriers are saying that they're going to be off, people are going to be off by $10, $20, $30, one way or the other. And so it's going to significantly shift things. And the way that these people have to bid, my analogy of it is like you're throwing darts at a dartboard normally, and everybody's kind of like in the middle. And this year the bid amounts have been like pin the tail on the donkey, right? The old game that you used to play when you were kids. We're 80s kids. Yeah. So we used to play that, kids, where you'd get blindfolded and you'd get spun around a bunch of times, and then you'd either have to go pin the tail on the donkey or throw a dart at a balloon. And that's what bid process is going to be like this year. Darts, blindfolded, spun around. And so people are going to be all over the place on the carriers. And so we may have small premiums that we would have otherwise had zero premium.
You're going to have agents being like, why is this an $11 premium?
Yeah. And it's going to be so annoying if it goes that way to have to like explain to a consumer, well this is $11 a month. And it's like,
well, and the reality is if somebody, is already on a plan that suddenly gets a premium that never had one, and there's not like so for example, here's a sales tip for you all. Even when I was selling back in the day on a paper enrollment form or Sunfire, and you're talking about a premium, and agents would always ask me, like, why do I have to answer this premium payment thing when it's a zero premium plan? I would always have the discussion with the client and say, hey, which would you prefer, bank EFT, withholding from Social Security, or coupon book? And it's like, you know what, it's a zero premium anyway. We'll just put, so are you comfortable with Social Security deduction? Yeah, it's a zero premium. Okay, I would do that. And then you don't have to worry about a voucher like a coupon book or getting payment info or anything else. And I would always go to Social Security, make sure that they knew, make sure they were cool with it. But then again, going back to this year, well, now there's all these zero premium plans that might have $3, $4, $11 premiums. And that's just more friction if they don't have that election and suddenly they're going to get like a coupon booklet and premiums, and then get threats after 3 months of not paying their premium that they're going to get disenrolled. Now, is a carrier going to disenroll somebody after 4 months when they owe $12 in premium? They have the option to, but they likely will not. They're just going to get harassed by their health plan to be collecting $4, $7, $13, whatever it may be, and it's going to be so extremely annoying.
Yeah, and it's just going to be a different interesting sales nuance too, because the way that the industry has kind of organized itself over the past 5 to 10 years, zero premium Advantage plans have pretty much become the norm all across the country. Right. And supplements have been the ones having a premium. And now we might find, well, this year it's $7. And then you have to have this conversation with, well, why is there a premium and why is it so low? And so again, that's why hopefully you all learn something from this podcast, so you're able to have these intelligent conversations with your clients.
Yeah, make sure and spend that extra 30 minutes in every appointment to explain it, because you're going to have a lot of service work this year, but make sure and spend an extra 30 minutes and explain that.
Yeah, exactly. And you're going to have extra service work explaining the new Part D, because it's applying to the Advantage plans as well as the standalone drug plans as well.
I'm being a little snarky just thinking about if I'm in front of a client right now and having to explain their new plan, why there's a premium, talking about like smoothing process and the Part D Inflation Reduction Act in a very pragmatic and effective manner, and having a good appointment, and how long that sales process would take.
Yeah. So there's, we'll bring it all home. And then I have 2 rumors that I'm hearing that I just want to like get on the record, but see what happens. But what Dan's saying is, spending all this extra time, what we just talked about, we need a more sophisticated agent. We need intelligent agents. There's a lot of disruption. There's going to be a lot of opportunity for you.
And I'm going to say, hey, if you want to be a sophisticated agent and know your crap, we train sophisticated agents. So that's my plug.
Come on board. The other thing, as the way the industry is currently, and what we've said on a couple podcasts ago, and I'm having some conversations on LinkedIn, et cetera, is agents are wondering, well, it sounds like just the way the comp landed with there's less HRAs. That's one thing that we didn't talk about, is HRAs from some carriers are coming back in some form or fashion, but some of the carriers have just said, nah, we're not doing it, right? So you're going to have co-op come back in some form or fashion, but it's going to be slimmed down. So
I am going to go on the record, and like always, shout out to Cigna said, hey, our HRAs are back on.
Yep.
Like Cigna said, HRAs we're doing business as usual. We're paying the tiers, we're paying commissions, we're paying $1 per app, we're paying the HRAs. We're going business as usual until we can't.
Yep.
So they absolutely said that. Another carrier has already alluded and said, hey, we're probably going to pay on DSNP. We're going to bring those back. Other carriers have said, we put out a communication and we're actually going to walk that back and bring those back for agents. So
yeah, but either way, if you're, because we were expecting either an increase in FMV with a reduction of these other things, like Dan said a couple episodes ago, there's less money in the ecosystem right now than there's ever been before for both the agents and the FMO side of things. And that's just a little bit of a factor of all of these things that we've been talking about over the past couple of weeks.
Well, look, the entire supply chain has less money. So from CMS down to the carrier, even the reimbursement rates were lower. When you start looking back at, like we talked about, RADV and auditing and pulling back money and auditing from years past. So when you combine just the reimbursement rates with RADV in it, to the carrier, down to the FMO, to the mid-agency, to the agent, the whole supply chain, yes, all of it, less dollars. I am not seeing anyone anywhere in the supply chain who's winning, but you know who is winning? The lawyers are winning. That's for sure.
No one's on my side except the lawyer. Yeah. Well, a couple of things to close with then is I think there's a couple of rumors that I'd heard that were interesting over the past couple of days. One is part of this Inflation Reduction Act. As we know, and one of our most recent favorite South Park episodes is the one about the healthcare system and the GLP-1s, the semaglutide.
We should play the song.
Yeah, the navigating the American healthcare system. Butters has a really funny journey on navigating, trying to get insurance to pay for his GLP-1s.
Cartman.
Yeah. Oh, yeah. Cartman. No, they're trying to help him get it paid for it, yeah. And very hilarious. But to that point, I'm hearing that GLP-1s, because of this Inflation Reduction Act, are going to see an increase in cost. There's hundreds of thousands, millions of people on Medicare that are taking these GLP-1s, the semaglutides, the Ozempics, and they are going to have a pretty substantial increase in costs. Instead of it being a fixed copayment, we're hearing the word coinsurance, on a lot of these Part D drug plans. So a lot of people that have been taking those are going to see a cost increase. And I would imagine they're probably going to be heading very quickly towards those $2,000 out-of-pocket maxes. So kind of be prepared on that. Another interesting thing we're hearing, and this is kind of like, I couldn't believe that CMS is fixing to drop another call letter, a 2026 call letter before the E word, before the big event in the fall, the E. And or
around that time. So I take issue with it. So what you're going to, well, I'm going to run with it since you brought it up. I didn't know we were going to talk about that, but yeah, the rumor mill is, so if you go back to history, every single year, typically CMS would put out their call letter. Usually it was around February. Mm-hmm. And so what would happen is, carriers are already in their bids, their war games. They're already prepping their plans for the next year. Let's be honest, usually about 15 to 30 days into annual enrollment period, the carriers kind of know where they're going to land. They can put things on a trend line. They know exactly how their strategy worked.
Probably the first week, yeah.
Yeah, and they know where they're going to end up. And so they're already planning out their next year. And what will happen is usually CMS is putting that call letter out in February. And then, of course, carriers can, react to that, respond, do whatever else, and they have to get their bids in early June, like June 4th, for their filings, right? That's how it's always been. That's how it was in 2022 and 2021
and usually it's pretty minor changes, maybe some marketing guideline updates.
So this call letter, and why it was such a big deal is because they dropped it in November, which was like 3 months early. And so now we're talking about them doing it again and even bumping it up sooner into November. And rumor and rumblings on the street are that CMS might drop one more letter, I don't want to say on their way out the door, but just like another, it would be like a fifth, cycle, getting an extra calendar year of changes in there to squeeze it in or attempt to. So I don't know.
Yeah, it's like, which again, I really challenge the wisdom, and it's like,
but there's already so much that has been put and packed into one call letter that the industry, and I'm not just talking to us, but at large, has not even been able to implement. Everything in the call letter was commenter, said this about the timeline and practicality and implementation timelines. Commenter said this, and those have been the things, is that there needs to be a reasonable period of time to do it all. And then to drop yet another one into November would just be brutal.
And it's the way it seems is that CMS would be anticipating, or just in case there is a regime change in the nation, we can't talk too specifically, that they're trying to get as much out of their agenda or regulations that they want to see happen in the industry before they may not have that regulatory authority.
Yeah,
right. There's, like Dan said, there's already been so much that we're still digesting right now that I just go, please no, we can't take more. Like our heads are all spinning still, and we're trying to make heads or tails of what's currently going on. We don't need anything. And maybe, hey, I'll give CMS some credit. Maybe it'll be great. It'll offer a lot of clarifying points, and it'll clarify a lot of this ambiguity that we've been talking about, and have great answers.
Yeah, maybe that is going to be it. Maybe they've been, maybe there's rumblings about some of these other elements of the call letter that could potentially be challenged, and maybe they're going to go early to give us a lot of clarifying.
Give them the benefit of the doubt.
Yeah.
and on that, so again, guys, lots of stuff. Everything's fluid. I think the phrase that I'm hearing the most right now is we still don't know yet.
Here's the last thing to wrap up with all of this. Look, our actual job, we're a sales organization, right? At the end of the day, we're an FMO, IMO, call us whatever. We're in sales. We've always been in sales. There's a huge landscape, a great opportunity this year. There's a lot of disruption. There's a lot of consumers that are normally not very, prone. They don't want to have a conversation. They're happy. They're content. The world is going to be your oyster. It's a great sales environment this year. And the one thing that I will also tell you is, look, listen to our podcast when you're in the car, when you're doing something, educate yourself a little bit here and there. Yes, be educated. Don't be a Zoom zombie. Look, if anything, the best advice I can give agents listening to this is spend your time, develop your game plan, work on it, but tactical, strategic, tactical. Get your plan in place, spend a little bit of time, focus on controlling the things you can control, and go execute and go actually kick ass and make sales this AEP. Don't become paralyzed, spending all of your time researching everything that there is to do with every single thing to where it overwhelms you and you can't go be a great sales agent.
Yep, absolutely. My add-on to that is, like Dan said, the industry is it's eliminating out these low acumen, low information agents out of the industry. And you are you hold a professional license, a professional accreditation. You have a fiduciary duty to these beneficiaries to know what you're talking about. The days of just being able to, pick up a summary of benefits right before annual enrollment and kind of learn a couple market nuances are done. You've got to be a much more sophisticated professional to have success in this industry. And so we keep talking about the word consolidation. We're probably going to see some agent consolidation too, where you have a lower acumen, lower quality agent that's getting bounced out of the industry, but that's going to provide more opportunity for you higher acumen agents that are willing to invest in development, know the nuances of the industry, and really be a skilled professional. So if you're one of those agents, again, we'd love to work with you in some way, shape, or form. And if you get any value out of this podcast at all, please like, subscribe, hit the bell, share it, comment below. We know that there's a lot of you people in the industry that listen, that talk to us face to face, that say you listen. Give us some comments. Let's get we got a lot of lurkers out there.
They don't want to subscribe because their profile's like Sexy Man 24 or something like that.
Or it's like, oh, I work for this carrier, or I work for this FMO, or I work for this agency, and I don't want other people to find out that I'm listening to this. It's like, there's so much weird intrigue in our...
But I will say big thanks, because we just started kind of promoting and growing the podcast. We've been shooting this for over a year now.
Almost a year.
Yeah, not even a year, but we just started promoting within the last 6 weeks, and we went to over 6,000 subs in 6 weeks. So, again, we really appreciate the growth and, the participation from you all.
Yeah, we're getting around 130 to 140,000 unique listeners every month right now between the podcast platforms and YouTube. So really appreciate all of you guys.
Yep. Anything else we got?
Nope.
All right. Till next week. Let's go.
Thanks.
Agent Boost.